She had the kind of stillness that made people uncomfortable without knowing why. Not unfriendly. Not cold, just present in a way that felt different from everyone else in the room. Like she was always the only person in any given space who knew exactly where all the exits were. Cara Novello walked into St. Augustine Medical Center on a Wednesday morning, carrying a second-hand backpack, a travel mug of black coffee she had already let go cold, and 17 years of muscle memory. She had no intention of ever explaining to anyone. She signed her employment paperwork with the same looping signature she had used on classified mission briefs in places that didn't appear on any map civilians had access to. She clipped her badge to the chest pocket of her navy scrubs. She found her station in the intensive care unit, and she got to work. Nobody at St. Augustine knew anything about Cara Novello except what was on her resume, and even that told only half a story. The resume said nursing degree from the University of Arizona, board certified 3 years of acute care experience, relocating from out of state. It did not say that the 3 years of acute care experience had taken place in active combat zones across 3 different continents. It did not say that she had once kept a man alive for 6 hours in a drainage ditch with a kit that would have made most ICU charge nurses laugh until they cried. It did not say that she had been awarded a commendation so classified that the certificate was stored in a facility she could not name, for an action she could not describe, by a branch of the military whose public-facing existence had been debated in congressional hearings, and for a decade the resume did not say any of that. And Cara Novello had not volunteered a single word of it. She had transitioned out 14 months ago quietly, the way she did everything. Filed her separation papers. Completed her exit interviews without incident. Sat across from a military counselor who had asked her carefully what she planned to do with the rest of her life. She had looked at the wall behind him for a moment and said she was going back to nursing. He had nodded like that made sense. She had not told him the real reason, which was simpler and harder than anything she could have explained in that office. She was tired of losing people. She had lost too many in the field in the dark, in situations where even doing everything right wasn't always enough. She wanted to work somewhere with electricity, somewhere with a supply room, somewhere where the difference between life and death was skill and not terrain. She had chosen St. Augustine specifically because of its trauma designation. Level 1, the real work. The cases that came through at 3 in the morning and made strong people fold at the knees. She had not chosen it because of what the staff culture was like. That she learned in the first week. The ICU at St. Augustine was run in practical terms by a man named Dr. Gregory Ashford. His actual title was Chief of Critical Care, but what he functioned as was something more like a gravitational field. Everything in the unit bent toward him or away from him depending on his mood. And his mood was on most days not good. He was 53 years old, trained at Penn, decorated with publications and speaking invitations, and a photograph on the wall outside the conference room, in which he was shaking the hand of someone whose name appeared on a hospital wing. He had been the most important person in that unit for so long that he had genuinely stopped believing it was possible for one to walk through those doors and know more this than him about anything. He noticed Cara Novello on her second day. He noticed her because she did not flinch. A patient had coded during the early hours of the morning. Cara had been 2 beds away, checking IV lines when the alarm sounded. By the time the crash team arrived, she was already at the bedside, already running compressions, with the kind of measured, unhurried force that came not from panic management but from something pre-existing. She had intubated before in the field, under conditions that would have made the crash team's hands shake. This was a clean room with good light and everything she needed within arm's reach. She was in relative terms comfortable. The patient survived. Dr. Ashford arrived 3 minutes into the code and stood at the foot of the bed watching Cara work. He did not say anything then, but she caught his expression in her peripheral vision. Not admiration, not relief, but something that read more like suspicion. Like a man who had just seen something he didn't recognize, and had decided preemptively not to like it. The pattern started within the week. It was incremental the way these things always are. He reassigned her to the transitional care ward for 4 days without explanation. A move that had nothing to do with staffing, and everything to do with removing her from the acute cases. When she came back, he began requiring her to co-sign every medication adjustment request with a supervising nurse, a requirement that did not exist for any of the other ICU nurses. He began reviewing her patient charts personally, leaving corrections in the margins in red ink, for errors that were, when examined closely, not errors at all but legitimate clinical judgment, calls that any competent nurse would have made. He introduced her to a group of visiting residents as one of our newer nurses, still getting oriented. She had been oriented before he got his medical degree. Cara accepted all of it without a word. She had served under men who thought competence in someone else was a personal insult. She had taken orders in conditions that made a hostile ICU environment look like a minor inconvenience. She said nothing. She documented everything. She did her job and did it perfectly, and waited with the particular patience of someone who had learned that time was a more reliable instrument than confrontation. What Ashford could not have known, what he had no possible way of knowing, was that Cara Novello had spent 11 years as a special operations combat medic with a unit that officially did not exist. She had been recruited out of her nursing program by a defense contractor. And then again, 1 year later, by the unit itself, after her performance in a joint exercise, had apparently caught the attention of people who paid attention to those kinds of things. She had deployed 9 times. She had operated in jungles, deserts, mountain ranges at altitude, and frozen terrain that cracked lips and burned lungs and made everything take twice the effort for half the result. She had performed emergency field surgery on a teammate, using tools she had fashioned from a vehicle kit and a satellite phone casing and a medical supply bag that was missing 2/3 of its contents. She had trained local medical personnel in 3 different countries under cover of civilian identity. She had been in firefights. She had made it out of every single one of them. Not through luck. Not through luck even once. Through the kind of hyper-aware situational intelligence that becomes biological after enough years. The ability to process a room faster than most people process a sentence, to see angles and distances and personnel and threat levels and exit options all at once, automatically the way other people breathe. She did not volunteer any of this information. She had signed documents that made certain elements of it legally inaccessible to her. But even the parts she was permitted to discuss, she kept to herself. She was not here to impress anyone. She was here to work. On the morning of her 5th week, she met Leonard Garza. He came in on a gurney at 6:47 a.m. Su paramedics, and a blood pressure so low the monitor read it twice before accepting the number. 41 years old, construction foreman found unresponsive at a job site. The paramedics had him on fluids. He was gray and sweating, and his breathing had the particular quality that Cara identified in under 4 seconds as something the attending physician had not yet caught up with. She flagged it immediate notes, in the specific language she knew would trigger escalation protocol. Brought it to the attention of the attending. Dr. Miriam Osi, who listened, looked at the chart and agreed. She ordered a CT and pushed the case to priority status. Dr. Ashford was in the unit when the order came through. He pulled the chart, scanned it, and walked to the nurse's station where Cara was standing. "What is this?" he said, not quite a question. "Intake assessment on Garza in Bay 4, she said. "I flagged possible aortic involvement based on the presentation." Ashford looked at the chart again. Then he looked at her. "You've been a nurse for how long?" "Long enough," she said. "Because this reads like someone who watched a lot of medical television and decided they had a differential diagnosis." He said it in a voice loud enough that 2 residents at the adjacent station looked up. "The systolic on arrival was 68, she said, same tone as before. "He's diaphoretic with that BP, and no reported cardiac history." The pain distribution the paramedics noted was bilateral flank, not chest. "That's a pattern. That is speculation from someone without the credentials to speculate." He said it pleasantly. That was the part that was hardest to absorb. The pleasantness of it, the ease. The way he used his authority like a man who had never once in his career paid any professional cost for being wrong. He overrode the priority status, moved Garza to standard intake, ordered a routine workup. Cara stood at the station for 5 seconds. She looked at the monitor readout. She looked at Bay 4. Then she walked to Dr. Osi, who was now 3 rooms away, and said quietly, "I want it on record that I believe Garza is a priority case and that the override is against my clinical recommendation." Dr. Osi looked at her for a moment. Then she pulled out her phone and made a note. 22 minutes later, Leonard Garza's blood pressure dropped further, and he began experiencing acute back pain. The CT that was finally rushed through showed what Cara had suspected from the beginning, a type B aortic dissection, the tear already progressing. The surgical team was paged. The case was elevated to critical. Everything happened fast and correct from that point forward, and Leonard Garza made it to the OR in time, and he survived. In the hallway afterward, Dr. Ashford passed Cara without stopping. She did not wait for an acknowledgement. She had already moved on to her next patient. But 2 nurses at the station had watched the whole thing, including the override and the note and the outcome. And people talk in hospitals. Quietly the way water finds its way through walls. The morning that changed everything came 3 days later and arrived without warning. The way those mornings always do. It was a Thursday. The unit was running at 87% capacity, which was normal. There was a staff shortage in the transitional ward that had pulled 2 nurses from the float pool and left the ICU tighter than it should have been. Cara was managing 5 patients and cross-referencing medication schedules, and had not sat down in 4 hours. Dr. Ashford had been in a department meeting since 9, and wasn't expected back for another 40 minutes. At 11:14 a.m., 2 men walked through the ICU access doors. They did not belong there. Cara knew this before she had consciously identified the reasons she knew it, the way she always knew. The body understanding the signal before the mind finished processing it. They were moving wrong. Not the hurried, anxious movement of family members who had gotten lost following directional signage. Not the purposeful stride of transport staff. Something else. Something with a quality to it, that had no business being in a hospital, but that she had seen in specific professional contexts, and it put her on alert in the quarter second. Before her brain finished translating the input, she kept her hands moving on the keyboard. Her eyes tracked them in the monitor reflection. The taller one, mid-30s, tactical jacket, close-cropped hair, a posture that said former military or current something she didn't want to name, went straight to the nurse's station. His companion held near the door, not casual.
Position.
"We're looking for a patient," the taller one said to the nurse at the station, a young man named Keith who had been working there 6 weeks. "Leonard Garza. We're family." Keith started to pull up the system. Cara crossed the unit in 8 steps, calm and unhurried, and positioned herself at the edge of the station. "I can help you with that," she said. "Can I see some ID?" The taller man looked at her. His expression was professional neutral, which told her more than irritation would have. "Family doesn't need ID to visit," he said. "In the ICU, yes they do," she said. "It's policy. I'm happy to wait." He did not produce ID. He looked at her with a flatness in his eyes that she recognized, the look of someone running a calculation, assessing a variable they hadn't expected to encounter. "We'll come back," he said. They left. Cara watched them go. She saw which direction they turned in the hallway. She noted the time, 11:17, on the unit log without explaining why. She went to find Keith and told him quietly that he was not to share any information about Leonard Garza with anyone who was not wearing a St. Augustine staff badge, or who could not produce verifiable next of kin documentation. Keith nodded. She could tell he didn't fully understand why, but she didn't have time to explain. She called the hospital's security desk and reported the interaction. The man she spoke to, a guard named Raymond, who had worked the desk for 11 years, and sounded like someone who had heard most things, told her he'd put it in the log. She asked him to put a temporary access flag on the ICU entry doors. He said he'd have to check with his supervisor. She said. "How long will that take?" he said. "Could be an hour." She said thank you, Raymond, in the tone she used when she was setting aside a piece of information to solve herself. She went back to her patients. She was monitoring vitals in Bay 3 when she heard the doors. Not the soft pneumatic release of someone using the keycard reader. A harder sound, a brief electronic stutter. The doors opened with the specific resistance of a bypassed system, and Cara was already moving, before she had consciously finished identifying what she was hearing. There were 3 of them this time. The 2 from before and a third man she hadn't seen. Older, broader, with the kind of face that had absorbed some history and not all of it voluntary. He was the one giving direction. She read it in the microgravity of the other 2 relative to him, the way they angled and deferred without appearing to. He scanned the unit and found Leonard Garza's bay in approximately the same amount of time it had taken Cara to find the exits on her first shift. He began walking toward it. Cara was faster. Not running. She didn't run, because running in an ICU produced alarm, and alarm produced chaos, and chaos was the last thing she needed. She moved the way she had learned to move in close-quarter environments, quickly, smoothly, without announcing herself until she was exactly where she needed to be. She reached Bay 4 3 steps ahead of the leader, and turned to face them with her back to the glass partition, her hands visible, her posture so, still it created its own kind of space. "This bay is restricted," she said. The older man stopped. He looked at her the way the first man had looked at her, but with more authority behind it. He was not surprised to be challenged. He had been challenged before, but he had the bearing of someone who expected challenges to resolve quickly in his favor. "We're not here for you," he said. "I understand that, but that patient is post-surgical, critical status, and this unit requires authorization for all visitors." She paused. "I'm going to have to ask the three of you to return to the main lobby." "That's not going to happen," he said. Behind him, she had already mapped the unit again in the 40 seconds since they entered. Keith had seen them come in and was reaching for the security phone. She caught it in her peripheral vision and made a small, deliberate movement with her left hand. A gesture she had used in the field to signal hold position. "Not yet." Keith stopped. His hand stayed near the phone. The taller one from before moved toward her left. She registered it without reacting to it. She kept her eyes on the older man, because the older man was the decision-maker and the decision-maker was where this resolved or didn't. "I know what you need," she said, dropping her voice slightly, "and I understand why you're here. But there are 11 other patients in this unit and 4 of them are on ventilators, and if you move past me right now, you're going to have a situation that none of you want. Hospital security is going to be on this floor in." She checked the clock over his left shoulder. "Less than 3 minutes. You leave now. This doesn't have to become something it doesn't need to be." The older man looked at her for a long moment. She held his gaze with the particular quality of stillness she had spent 11 years developing. Not aggression, not submission, just absolute immovability, the kind that transmitted a very specific message. "I know something you don't know about what happens next." The taller ones had stopped moving. The older man made a decision. She saw it happen. The slight shift in posture, the recalibration. 2 minutes, he said. "And then we talk." "Lobby," she said. "Not here." He looked at her one more time, then he turned and walked back toward the door. The other 2 followed. She kept her eyes on all 3 of them until the doors released and closed behind them. Then she turned to Keith and said with complete calm, "Call security and tell them the ICU access was bypassed at 11:41. 3 individuals, give them the description. Tell them to hold the stairwell exits on 4 and 5. Keith's hands were shaking slightly when he picked up the phone. He made the call. She walked to the nurse's station and picked up her own phone and called the administrator on duty, a woman named Pat, who had been in hospital administration for 25 years, and who when Cara finished speaking said, "I'll have security up there in 90 seconds and I'm calling the police now." "Thank you," Cara said. And then, because she thought it was worth saying, "Make sure they check on Garza's discharge protocol. He should be moved to a different floor under a different name as soon as the surgical team signs off." There was a pause on the other end of the line. "Who are you?" Pat said. "Cara Novello," she said, "ICU 5th week." Security arrived in just under 2 minutes. The police arrived 9 minutes after that. The 3 men were located in the parking structure on level 2, where they had apparently decided that waiting was still a viable option. 2 of them were arrested. The third, the older one, was detained for questioning and subsequently released, though Cara was informed later, through channels that surprised her with their specificity, that his name had appeared in a federal investigation she was not authorized to know more about. Leonard Garza was moved to a different floor the following morning, under a protocol modification that the administrator had apparently decided required no committee approval. He was discharged 8 days later. Dr. Ashford arrived on the unit floor 40 minutes after the police left. He had been in his department meeting when it started, and in the elevator when it ended, and by the time he walked through the ICU doors, with his badge swinging from his lanyard, and his expression arranged into the alert competence of a man in charge. The police had already taken their statements, and the unit had returned to a state that was visually almost completely normal. He stood at the nurse's station and someone, Keith, probably, gave him a summary. Cara was at the medication cart, preparing afternoon dose. Her back partly to the station, she heard him listen. She heard the silence when Keith stopped talking. Ashford walked toward her. She heard his footsteps and did not turn around. "Novello," he said. She finished labeling the medication cup in her hand before she turned. "Dr. Ashford." He looked at her for a moment with an expression she didn't quite have a category for. Not the professional contempt of the past 5 weeks. Not guilt, exactly, though something adjacent to it lived in the vicinity of the look. His face had the quality of a man who had just been handed information that required him to recalibrate something he didn't want to recalibrate. "You handled the situation," he said. It was not quite a compliment and not quite an observation. It occupied some third category that he seemed to be inventing in real time. "I did my job," she said. He looked down at the medication cart, then back at her. "The patient this morning, Garza. The dissection." "Yes, your flag was correct," he said. She waited. The override was, "I may have been hasty." It was the closest to an apology she suspected he had come in a long time. And she knew enough about men like him to understand that it had cost him something measurable to say it. She did not reach for more than he was able to give. That was not what she was here for. "Noted," she said. And she turned back to the medication cart. She heard him stand there for another moment. Then she heard him walk away. That evening, the administrator, Pat, she had learned her full name was Patricia Harmon, called her into the small office adjacent to the unit, and closed the door with the particular care of someone who intended the conversation to matter. Patricia Harmon had the kind of face that showed its history honestly. She had been at St. Augustine for 25 years. She had seen staff come and go. She was not a woman who offered things she hadn't thought through. She told Cara that the incident report had gone to the chief of medicine. She told her that there had been a conversation with hospital legal and with the security director, and she said with a slight pause that Cara did not push on some individuals from outside the hospital whom she was not at liberty to name. She told Cara that Leonard Garza's family had called the administrator's office that afternoon to thank the ICU staff by name, and that Cara's name had been the first one the family used. Then she set a folder on the desk between them. "I want to offer you the senior clinical coordinator position for the ICU," she said. "It's been vacant for 4 months. We've been interviewing internally and haven't found the right fit." Cara looked at the folder. She did not open it immediately. "That position normally requires 5 years of acute care experience." "Yes," Patricia Harmon said. "I'm aware." She paused. "I'm also aware that your file has certain sections that are blacked out, which in my 25 years at this hospital I have only seen twice before, and both of those individuals were extraordinary." Cara looked at her. "I'm not asking for information you're not able to give me," Harmon said. "I'm telling you that this unit needs someone who can do what you did today. Not just the physical part of it. The part before, the patient, Garza." She folded her hands on the desk. "You saw something that a physician with 30 years of experience missed, and you went on record about it before you had any way of knowing you were right. That's the thing I want in that coordinator's office." Cara was quiet for a moment. Outside, through the narrow window in the office door, she could see the ICU floor, the monitors, the quiet controlled movement of the nurses, the stillness of patients held in that particular suspended state between crisis and recovery. She had worked in a lot of places that didn't look like this. She had worked in places where the floor was dirt and the monitors were non-existent, and the suspended state between crisis and recovery lasted about 40 seconds before it went one way or the other. This was better. This was worth being here for. "I'll take the position," she said. "But I want to revisit the intake protocol for aortic presentations. The current triage criteria are going to miss cases." "Write me a proposal," Harmon said. "I already started one," Cara said. Harmon looked at her with the small particular smile of someone who had suspected as much. She slid the folder across the desk. Cara picked it up. She looked at the title on the first page. She thought about the 11 years she had spent in places she couldn't talk about, doing work that would never appear in a professional history, for reasons that had everything to do with believing that what she was doing mattered. She thought about the men she had kept alive, and the ones she hadn't. She thought about the drainage ditch, and the improvised kit, and the particular color of the sky in the Zagros Mountains, at 0400 when the mission was over. And everyone who was supposed to make it home had made it home. She thought about Leonard Garza, gray-faced on a gurney, at 6:47 in the morning, still alive because someone had been paying the right kind of attention. She signed the offer letter with the same looping signature she had used on everything else. She slid it back across the desk. "I'll have the protocol proposal to you by end of week," she said. She stood and she went back to her unit and she picked up the next chart. Outside the administrator's office, through the corridor and past the physician's workroom. And down the hall where the afternoon light came in sideways through the window at the end. Dr. Gregory Ashford sat at his desk with a patient file open in front of him and his reading glasses on the end of his nose. He was not reading. He was looking at a point somewhere above the file, at a space on the wall that held nothing in particular. He sat there for a long time, and in the ICU, Cara Novello worked the rest of her shift the same way she worked. Every shift, quietly, completely, with the absolute attention of someone who knew exactly how much any given moment could cost. She checked vitals and adjusted lines and spoke to patients in the low, steady voice that seemed to calm them, even when they couldn't fully track what she was saying. She caught an early infiltration on a peripheral IV that would have caused a problem in another 2 hours. She stayed 40 minutes past the end of her shift because a patient had spiked a fever, and she wanted to see the first set of repeat cultures before she handed off. When she finally walked out through the stagsit at the end of the evening, she paused for a moment in the doorway. Not dramatically, not with any visible weight to it, just a half-second of stillness. Then she shouldered her backpack and walked out into the parking lot, past the streetlights and the idling transport vehicles, and she did not look back. She had done her job. She had done it the way she always did, precisely, without ceremony, and well. That was enough. It had always been enough. And the next morning, she would do it again.